Yes, we are back. This is the World of Wellness Weekend. This is day one of the workshops. Our incredible lineup of speakers continues right now with Dr. Maribelle Verdiales, our favorite sexual health and fertility specialist down in Atlanta, Georgia. Dr. V has been working with us now for several years. She is the author of this amazing book, and you can get it from Dr. V herself, or you can get it right here at the World of Wellness or from Nutritional Frontiers. And Dr. Verdiales has also, what do you call it, Dr. V, for a lot of reasons, but for just to shorten it a little bit, Dr. V has contributed not just to the education of our physicians and their patients, but to the formulation of some amazing products here at Nutritional Frontiers. Starting back with one of the most successful launches of all time, our Women's Complete Formula. And then following that up, because her specialty is fertility and reproductive health, she followed that up with two amazing formulas, fertility and virility, and they have been flying off the shelf. We're getting amazing results. But then that wasn't enough. She didn't stop there, Phil. Now we've got our newest formula, and it's called UTR, and that's for uterine tissue repair. The glandulars in these three formulas are amazing, and Dr. V brought them to market with us, and we are so appreciative. But Today, we wanted to spice things up a little bit, have a little fun, and talk about human sexuality for all. Why? Because without it, we wouldn't be here. That's why. Right, Doc?
Absolutely, absolutely. You know what they say? There's two things that make the world go round: money and sex.
Yeah. That's right. That's right.
Right?
Absolutely. Yep.
My grandpa used to say that because of our most innate and basic, needs, there are empires that have been lost.
Ah, yes. I'm sure.
Mhm. So,
Absolutely. The Roman Empire being one of them, right?
all righty. So let's just dive into it.
Let's dive into it. What do you have for us today?
Absolutely. So let's talk about sex. So when I was going through my own training as a doctor in my early 20s, I thought it was very interesting when I went through my embryology class that we actually all start as females. Okay, did you know that?
That's the rumor I heard going around. Yeah.
So when they say the stronger ones, we actually even have more DNA than the boys do.
Uh-huh.
Since our X chromosome has that extra leg that your guys with the Y chromosome is missing. So,
Ah.
so the
Hmm.
default for reproduction,
Extra leg. But well, okay, I'm not gonna go there. Go ahead.
and we can debate whether we have the extra leg or is the or or the power of the leg, so the
Uh-huh.
whatever. But anyway, our default is actually being a female. So if you go down to the next slide, that's how all it begins. All right. So if you look down at where it all started in the middle picture, you see that there's a point in our development. It's usually around like 12 weeks of pregnancy that if you look at a fetus at that age, it's not very distinguishable because the clitoris and the penis are actually the same size. What happens as the Y chromosome starts sending the signal, I'm a boy. Actually, to be a boy, you have to scream for it. You have to go, I'm a boy, I'm a boy. So that sex determined region sends the signal out, and then that's where the differentiation starts. The clitoris in the boys would start growing with the baby and eventually become the penis, while in the girls it'll grow to about 16 weeks and then stop growing. And then that's why our penises are smaller, they're just more powerful.
Yes, yes, we know you control the world. All right, keep go ahead.
So if you look at how it all started, a common misunderstanding of female sexuality is that the vagina is the center of pleasure. Well, that's not our penis. Our penis is the clitoris. The clitoris is the female center of pleasure because it has the same nerve endings that the penis has. It's just more concentrated.
Okay.
Okay. Uh,
Okay.
yep. The
I'm
vagina
with you. Go ahead.
Yep, the vagina actually gets formed of the space that would be between in the guy. You know, if you compare anatomy of what their predecessor was, it is the what would be somewhere between the testicles. If you have ever seen a guy, or if you are a guy and you have observed your private parts, you see that there's a line going from the glans all the way to the rectum. Okay, so that gland, if you look at the picture higher up, it's open in early development. If you scream hard enough, I'm a boy, then that's closest off, all right, creating the penis and the scrotum. And then right before the baby's born, the testicles or the boy's ovaries come down the canal and boom, get into the sac, right?
Hmm.
So,
Wait a second. Wait a second. That's
yeah,
I have never heard it referred to that way before. So the testicles are a male's ovaries.
the testicles are the men's ovaries
Huh.
because they were inside your pelvis in the same location all the way to your last week of gestation. And there are baby
Really?
boys that actually have undescended testicle all the
Yeah.
way to a few
Part of
weeks
that.
after birth.
Okay.
So you were a girl in your baby, in your mom's belly. But I am
Wait a
so
minute.
happy.
When they do the ultrasounds, they can tell if it's a boy or a girl. But if when does that happen?
Yes, so I am very glad, Joe, that you had a strong enough scream throughout your mom's gestation. I'm a boy, and therefore we have Joe today and not Josefina.
Okay.
Because the reason I'm saying this a few times is because there is a genetic um, mutation where the signal, the SRY gene, is defective. And therefore, even though genetically this person is designed to be a male, if the signal is defective and cannot create that alarm system, what I said is right. The
Hmm.
default is being a girl. So they are born female looking, even though they don't have a uterus. And so they tend to figure this out during puberty when the period doesn't come. They have everything else develop as a girl, but because genetically speaking, they're actually XY. And then the other factors keep working, such as the anti-Mullerian hormone that is produced in a different gene. Then the uterine precursor, which is the Mullerian ducts, do get dissolved, what would happen normally in a boy, while for them, okay, that doesn't happen, and therefore they're a female with a blind pouch vagina. All right.
Hmm.
So next slide. So erogenous zones. Let's get spicy. It's very important that even though as a culture we think of erectile tissue of a stuck up pee-pee, we all have erectile tissue throughout our erogenous zones, including nipples. Nipples are erectile tissue. Same thing as the clitoris and the vagina is full of the same tissue that gets engorged, very vascular during arousal. But the nipples, for example, as they are breastfeeding, also get engorged and protruding into in that case, the baby's mouth. Okay.
Hmm.
And so back to the anatomy thing. So it's very important that for the guys, the happy button is the glans. Well, for the girls, the happy button is the clitoris. However, the whole genitalia, it's bathed in nerve endings, and they are shared with the peritoneal nerve, especially through the pudendal nerve and the S2 to S4. So that's why the anus is also part of the erogenous area. And I'm not going to go into those details, but as we know, it is part of playtime as long as everybody's happy with that. Okay. Nipples, like I was saying, play a role in sexuality because of oxytocin production, and I will discuss that a little later. So if you go to the next slide. So this is how it looks for those of you that have never seen one of these. This is a girl. Hopefully you have, but you never know. And that's kind of how the location of things are with the clitoris on the top, and then the labia minora, okay, which cover up the urethra and the vagina. So we do have an extra hole while the boys just have two holes. We have three holes in that area. The last hole being the exit hole, and then you see the mons, which is on top of uh, the clitoris. That is shared between boys and girls. That's where the hair usually grows. Okay. And then the labia majora, which is the outside covering that is not fully developed until the baby is about a month old. Most baby girls, when they're born, their clitoris are still kind of sticking out a little bit, and finally it closes up into a beautiful flower. All right, next slide.
Okay.
So going to the boys, going back to that picture, the scrotum and the body of the penis is actually what would the labia minora would be. Okay, so it in terms of sensitivity, it's about the same. So it is erogenous, but not as strong in terms of sensation. Anus is an anus, so the exit it's pretty the same, boys and girls. And even though boys don't have mammary gland development, the nerve endings are there since the nervous system is one of the first organs that starts developing, and therefore the nerve endings to the nipples get developed in the boys and the girls, and the mammary glands are placed in. Remember, at default, you're a girl. The difference is that because you don't have the mechanisms to fully differentiate that tissue, it doesn't happen. And that's the reason that you can't find breast cancer in boys. It's just more rare because that tissue does not really develop.
That's an interesting comment, and I think that has, if you could probably attest to this, that over the last, I don't know how many years, the increase in breast cancer in men is probably more prevalent and due to the hormonal imbalance in our environment, diet, and lifestyle, correct?
Absolutely. When you have chemicals that will work as estrogen that we're exposed to, and we can definitely debate on the effect of phytoestrogens and estrogen-like molecules on males. It's pretty scary. So yes, boys are getting more and more exposed to those hormones that naturally are not in those concentrations in their bodies, and it will cause not only breast development that is abnormal, but breast cancer in men, and also affect testosterone balance. And therefore, I'm seeing more and more lower testosterone in younger men. And the reality is that even though men do go through andropause, it is a natural process for men as well, just like menopause would be for women. In the guys, it should be a lot later in life. We're talking about 60 to 70, where they say it's gradual decrease in testosterone production. Men should be fully reproducible into their 60s. I mean, that is the reality of our programming, but that's not what I'm seeing in my clinic. So
Okay.
yes, and but it's not the future is not that dim, and there are many choices on how to correct that. And Nutritional Frontier has many wonderful products that help this process of eliminating the wrong things and increasing the right things. And I will talk about some of those products at the end of this presentation.
Great.
Okay, next slide.
Mhm.
So the Boy's Anatomy, for those of you that have not seen Boy's Anatomy, this is a transverse look. The urethra gets incorporated into the penis. Therefore, boys only have two exits. So during erection, there's a valve that gets closed up such that you cannot pee while you're excited. For those of you that have a penis, can attest to this, that I only know on theory. And then the rest, like bladder, rectum, it's the same as the girls. And then you have descended glands, right? Gonads, and that would sit outside. The reason that this process happens is that the testicles need to be a degree or two less than the body temperature is. And this is extremely important for reproduction. Even
Mm.
though some of you guys out there like to be tidy-whitey, the boys love to be hanging and free. So let them air. Next slide.
No, that's right. You know what? I mean, Seinfeld did a great episode on that. I think
Right? Let them
yeah,
free. Let the
uh,
boys
they
free.
got to be free. The boys got to be free. Yeah.
So, so I wanted to go through what would happen. What happens normally in a human as sex or a sexual event happens. There is the arousal portion of it. Okay, so let's break it down because this is very important as we find challenges in our clients, because they can be very specific. So you have libido. All right, libido is different from arousal, that is different from orgasm. Okay, so libido is the desire to engage. All right, meaning you have not been touched, you have not, but it's the desire to engage in sexual activity. Arousal is once you are engaged in sexual activity, can you start going through the physiological changes that would lead to an orgasm? Okay. And then orgasm, it's the climax where all of these endorphins are released and there's the final resolution and release. Release in men, it's very visual, okay, in the ejaculate. Release in women is just the sensation by itself, even though some women will produce more lubrication that in the public eyes they ejaculate, but it's just an extra production of lubrication that could be interpreted that way. So when we go into what happens during the orgasm itself, the orgasm is divided into four stages. All right, stage of excitement as you're building up, there's more engorgement, there's more blood flow to the genitalia. Okay, there's more secretions by exudation. What does that mean? We don't have glands that put out moisture down there. It's actually the exudate. Okay, so it's because of vascular dilatation, there's this lubrication that comes out through the walls. The plateau is moments before the final shoot up, where you have reached that maximum potential. if you want to call it that way. And you can start feeling the orgasm coming. And then finally, the orgasm is
Yeah.
when you get there and you find that happy me happy boo boo spot, all right. And then after the orgasm is the resolution. The orgasm really, it's not only an endocrine situation, but it's also a nerve situation when all these nerves get excited at the same time. There's this coordinated event where they all get activated and trigger, and the resolution is just those nerves with all those kind of saturated neurotransmitters that kind of slow down, and that those nerve endings are usually, it's unpleasant after the orgasm to actually get them stimulated because they're kind of balancing themselves out. Certain women will talk about being multi-orgasmic, and the reality is that I think even though sexuality is so diverse in how people get to the stars and what they like and what they don't like, there is individuality, and of course, sexuality has a lot of psychological involvement, including preferences, right? That's where fetishes come in and all that stuff comes in, but that's a whole different lecture. But in terms of multi-orgasmic, that what does that mean is that there's a resolution phase is shorter, so they can just jump on another orgasm faster than a guy can. Okay, next slide. So again, this is an example of what happens in terms of the pressure and the vascular, the volume. There is an increase in volume. Again, in guys, is noticeable because it is kind of crucial for that volume to be increased and aroused for penetration to occur. But in girls, the same thing happens. It's just more hidden, if you want to call it that way. Next slide. So, like I was mentioning before, it's very important to break down the different challenges that we can find, that inhibit us from having a healthy sexuality. So, the desire, right? The libido part, the arousal excitement phase. I just don't feel like it. Okay. The orgasmic dysfunction. I can't get there. I want to. So, you can have somebody that wants to, somebody that can get aroused without problem and just can't get to the final destination. No happy ending. Then you have the pain syndromes, and those are very
Hmm.
complicated, even though they're more common in women than men, because it could have physiological issues or anatomical issues, and then it could have also psychological component, and that it's like I said, it's very complicated. Somebody that could have been molested as a child, then it's going to associate touching genitalia with pain, and that can be
Hmm.
conscious. And remember, nerve endings, pain and pleasure are very close. Touching nerves, sensations. So whatever gets registered in the back of your head, it could be a little hard to kind of switch over to the other, the other meaning, because there's signals, the meaning of the signal. So then you have, some diagnosis in terms of pain syndromes. Like I said, more common in females, but they're not absent in men. Okay. Lubrication challenges. It's sandpaper. So
That's
remember
rough.
that
That's rough.
it's
Yeah.
a rough situation to be. Again, definitely more relevant to girls, okay? And many reasons why this could be a challenge. It could be from what type of flora is down there, okay? Are you having an infection? Are you having excess candida down there that is changing the composition of the fluid that gets? Remember, the exudate is just liquid coming out through the walls. So if what's
Mm.
there is the wrong thing, then the actual consistency is not going to be right. And then you have actually exudate issues like they happen in menopause just from less vasculature and thinning of tissue. And then we can definitely discuss that later on all of these different challenges and what to do with it. And then you have the other extreme, being the hypersexual type, meaning you can't have enough. There is actually a medical condition of somebody that has spontaneous orgasms, and it's not a pleasant thing either. It's more common in women, and it's somebody that, again, probably has to do with childhood or something along the way. The signals got mixed up. So either they have spontaneous orgasms when they're stressed out, when their stress hormones go up. There's a trigger in the brain and they have an orgasm. So you can imagine how horrible it would be to have an orgasm during your final exam, right? You're doing, I don't know, accounting 101 final exam and you're freaking having orgasms. That is not pleasant on my book.
It's like that movie with Meg Ryan, right? When Harry met Sally, she was in the restaurant.
She was
She
in
was
the
faking,
restroom and then the next lady was like,
but
I
she was
want to have
having an orgasm in the restaurant. Yeah.
right. So can you imagine having an orgasm in the restaurant? I mean, she was playing with her date, right? But like for real, like you're on your first date and you're nervous, and next thing you know, you're like sweating bullets. I don't think that's pleasant for anybody. And some of this, on the medical side of things, some of these conditions can be so incapacitating that they go through even nerve ablation, so killing the nerves or part of the nerves, so they can have normal life. So a lot of things about sexuality that it could be challenging for some of our clients, and it's very important to understand how it works in order to help them better. Next slide. So, who doesn't want to have some hot, steamy all night sex for the birthday? The old couple say. All right, next slide.
At some
I,
point,
I, you know,
at some point, you just want to get some sleep.
how can you talk about this subject and just do just the straight
You
face?
can. You gotta have fun. You're right.
Ah, right. So, which brings me to some of the challenges I see in my patients. A lot of it has to do with emotional and psychological health, especially in women, because of inhibitions, right? We are designed to be sexual beings, okay? That's why children, they touch themselves. It feels good to touch yourself. It's not a bad thing. So we are designed to be sexual. Why? Because the species nature is very smart. Sex, okay, and orgasms. Why that? Because it's positive reinforcement to reproduction. It's kind of the dog and the treat. The orgasm is the treat from nature. So you reproduce and we don't get extinct. Okay, which brings me to sexuality and reproduction, which are from the same coin, both faces, right? It's a
Mm-hmm.
sign of youth, right? Because you want your young animals, right? You want the youth to be the ones that reproduce into the next generation. So, sexuality and reproduction, or being able to choose between the factory or Disney World, right?
Work and play.
Either the
Yeah.
playground or the reproduction factory,
Mm-hmm.
being able to choose, it's a sign of youth. Okay, so going along the same stuff, why we cannot have fun? What's the problem? So, like I was saying, emotional, psychological components that has to be addressed. All right, as any other disease process. I was having a discussion yesterday with one of my patients. If you understand that matter is condensed light, that means that we are light, right? That means that, therefore, where does this harmony come from? Disease come from? It comes a lot of times from blockages, emotional blockages that get manifested in our bodies. So even on this type of issues, the root cause is usually something else. It's not the biology itself, and that needs to be addressed. Hormonal imbalances, huge, massive. We were talking about excess estrogen in boys because environmental toxicity, or even whatever we're taking in, right? Hormones in food, the plastics, blah, 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 blah. So huge. It's part of the evaluation. What's happening in their bodies? Are they pre-diabetic or diabetic that are, it's not diagnosed or uncontrolled? And then that's a whole cascade of events with the elevated insulin, this vicious cycle that pushes through. Is there any vascular issue? Which, again, any type of chronic illness, any type of thing that could be affecting not only the hormones, but the nerve endings. And more important, I was saying how important this is. Vascular tissue, erectile tissue, that's how it works, okay? And then anatomical deviations. Are we dealing with anything that, for example, um, and I'm not going to go into the name of the conditions, but for example, there's a condition where the penis, because of early development, gets constricted to one side or another. So is that causing issues in for that person and or his partner? There are anatomical deviations in women. Women with one vagina versus women. I mean, I've seen women with a second vagina. Is that causing a problem? There's a septum. There's, abnormalities in the tract that's causing pain. All those things need to be evaluated by the appropriate healthcare provider. Next. So challenges are presented, so we find solution. Let's work on it. Simple, simple, simple. Lifestyle changes is the best bang for your money, anytime, every time, right? So sleep, eat, breathe, think the right way can take you very, very far. And I was saying how your erectile tissue is vascular. It's part really of the cardiovascular system. So exercise by itself, okay, doing cardio X amount of times a week, it's almost like taking your penis to the gym. All right. So incentive to exercise. It's been documented. People that exercise on a regular basis, okay, have better sexual response. They have better libido, and we can talk about better libido because now they're exercising, they're healthier, therefore their hormones are better. They have better sensation, better orgasm, more stamina. So I think that's pretty incentivized right there. And then you combine that with muscle building, which is very important in the guys, which also add to the stamina and the strength, etc. And then
Mhm.
with balancing hormones, then it's a win-win. Okay, so alternate um, weight lifting exercises versus aerobic exercise. You want to mix and match. And then you have the targeted exercises. So there's physical therapy of the pelvis. There's, the famous Kegel exercises, which, it's literally taking your vagina or your perineum to the gym. Ooh, 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 ooh. You get the picture. All right.
So the Kegel exercises benefit both men and women.
That is absolutely true. For those boys that either have
I am right now.
erectile issues, okay, they can't keep it up and going long enough, or they have premature ejaculation, they get there too fast. Getting there too slow or not getting there and getting there too fast, they're all problems, right? You don't want to get there too fast either. So for those type of guys, doing Kegel exercises could be life changing. Learn to control those muscles down there, okay? Even though the penis is a vascular structure, okay, it doesn't have any muscle, it just fills up with blood and stays puffed up. You know, the actual base of the penis, where those valves are that closed up those vessels, it's actually full of muscle. It's part of the perineum. So strengthening those muscles in that area is going to help with keeping the erection as well. So Kegel for everyone.
Kegel for everyone. All right.
Kegel for everyone. And then from the
Do we need to explain what that is? Does anybody know what a Kegel exercise is? Yeah, go ahead and explain what exactly it is, Doc.
yes. So I want you to picture squeeze, 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 squeeze hard, and hold it. Release. You get the
Squeeze
picture.
and hold. We get the picture. Okay, got it.
All right.
And you can
So,
do it anytime, anywhere, right? You and I could be doing it right now.
right, you can do it anytime. I tell some of my patients, do 5 to 10 when you're in a red light. That
Mm.
can take you a long way.
We'll make
Um,
red light go faster. Yeah, that's a good
right.
idea.
Think about it. Red light therapy. Ah, you'll never forget that one.
There we go. Oh, that's good. I like that one, Doc. I'll use that. Yep.
So I'm going to go through real quick the different, interventions that we can do, and then we'll dive into the juicy stuff. Um, if you're having hormone imbalances, you can address you can start addressing them through diet and exercise. And there are some wonderful supplements out there based on some magnificent herbs. And I'm a glandular sucker, so between herbs and glandulars you can go a long way. But let's say because of your particular clinical scenario or your preferences, there is hormone replacement therapy that can be used. If you're having dryness issues, there are different lubricants that can be used. Coconut oil, as you all know, is one of my favorites. And then you have, other more invasive interventions, whether you need surgery for those anatomical deviations. There's mechanical devices, for example, vaginal dilators for somebody that, for whatever reason, whether it's postmenopause or anatomical deviation, vagina is not big enough or stretchy enough. There's the O-shot, G-spot type of injections where you do PRP treatments to improve vasculature and nerve endings, and the thickness of the tissue. That can be done in men and women. Okay, these are medical interventions that can be done in men and women and are not as invasive as other alternatives. And then going back to the supplements. Next slide.
Oh, wait a second.
Let's start through some of these things. All right.
Mm.
So Um, I put this one in here, even though it's really not a sexual enhancement and it's not directly into the hormones, but it is and it's not, right?
Sure.
The female gonad is the ovary, and even in the ovary produces testosterone and estrogen. All right. And the balance between those two are extremely important in females and males. In females, estrogen and the estrogens, actually, it's higher than the testosterone, even though they can convert from one to the other, meaning testosterone can be converted to estrogen and estrogen to testosterone. And when those ratios are off, it does cause some clinical issues. But ovarian support is extremely important because then indirectly you're going to support the sexuality. So I put fertility there. It's a great supplement. Very good to keep that estrogen testosterone balance, especially on some ladies that have that challenge. And then on the other extreme, somebody that is going through perimenopause, menopause, you support the ovary, it's going to start working better. Therefore, there's a sense of anti-aging that occurs. You're gonna an organ that works better, that is better, will work better, and then will produce more hormones. So it has glandular in it. It has the myoinositol because it helps indirectly decrease glucose and insulin, therefore create a balance of that testosterone estrogen in some of these patients that have that imbalance. The NAC helps the liver. The liver is it's an endocrine organ, one of its function, even though it's not famous for that. And then the resveratrol, which is an antioxidant, anti-aging. Again, support the organ works better, and you can use it to your favor. Okay,
Hmm.
next. And then the boys version. Now, we do have two choices of the same thing. So virility is really like Testo 180 plus. It has
Mm-hmm.
all of the fantastic herbs that Testo 180 has, plus it has the glandular. So
Mm-hmm.
why glandulars? I mean, for those of you that have heard me before, I believe in glandulars wholeheartedly. Like helps like, and there are many theories on how this works. Essentially, if you have one organ that is, from a different species, right, but is going to help your organ. Um, Mammals are close enough genetically speaking that our organs are extremely different. Actually, the difference between you and a mouse is like less than 1%. So can you imagine? So um, the organ,
What about a rat?
yeah, there you go. So the organ that you're providing has all of the nutrients and the need that your organ, in case the testicle, in this particular scenario, to in the same ratios and the same nutrients that it needs. So one, it's like having that extra car with all the parts ready, so you take what you need. And the second is by something called oral tolerance therapy. So meaning it will decrease the immune response in favor of the organ in question. So sick tissue, sometimes it leaks into the bloodstream, it creates an immune reaction because it's identified as old and sick, and it gets attacked in a subclinical manner. So, therefore, by having this small amount of testicle, in this case by mouth, your immune system is 80% mouth to anus. So you're kind of vaccinating. I know that we love this word around here, but you're vaccinating in favor, okay? In favor of
The way it should be. The way a vaccine should be, right? Yeah.
that. Yeah, yeah, that is absolutely true. And we can argue whether vaccine should be oral versus in the muscle, right? If you're trying to elicit an immune reaction in favor or against, but that's a
Mm-hmm.
whole different lecture. So looking at some of these herbs, which are fantastic, that are found in both virility as well as testo 180, maca. Maca, it's a hormone balancer. It had, I mean, it comes from Peru and that region. It helps with stamina. It helps with testosterone production, but not. The beauty of herbal medicine is that it won't push you. Okay, it helps the body balance itself out. It won't push you to a place where um, it is abnormal, like exterior exogenous hormone replacement. It can push you in the wrong way just because you're giving the hormone itself. So you're just supporting the body to work better. Tribulus is another fantastic hormone balancer. It does help that estrogen testosterone balance as well. Ginseng helps with stamina, helps with energy. It's an antioxidant. It's an adaptogen, meaning it helps your body, again, what the body needs, instead of pushing in one extreme or the other. Ginkgo, it helps with vascular tissue. Very, very important. Supports the vascular tissue. And remember, I said that our genitalia is part of the vascular system. So great combination of herbs. And then what can you say about an herb that's called horny goat, people?
Yeah, gray herb, one of
That
my favorites.
that I think is self-explanatory what it is.
Yes, horny goat weed. Whoever came up with that name, that they deserved, yeah, an award. The best name for a nutrient I've ever heard.
Yes. I mean, I'm not even going to explain that one. All
No.
right. Next slide. Adrenal support. I put that there because the adrenal balances the testicles and the ovaries. It's a triad between adrenal, testes, or ovaries, and thyroid. All right. the adrenal also produces androgen, so testosterone like substances that do influence um, sexual response. And if you're overly stressed, okay, or you're going through some form of adrenal fatigue, your body is going to shut down precursor supply and even blood supply to your
Hmm.
genitalia. Because if you're barely surviving, then you don't get the bonus of reproducing, right? If you're barely surviving, then you're not suitable to bring another human being into this world, whether you're a man or a woman. And remember, sex is the treat of nature because you're trying to reproduce. So you
Right.
don't get the treat if you cannot reproduce. Okay, next. And then I was mentioning, if you look at the composition of Testo 180, is just like virility, except virility it's more targeted to boys with that testicular glandular. I use Testo 180 in men and women, okay, depending on what I'm trying to achieve. I use Testo 180 on my premenopausal, so my perimenopausal, my 40 plus year old women that are starting to experience some of that decrease in testosterone that happens
Mm.
before menopause and the effects of that in their bodies. And then the postmenopausal lady, it's a great combination for those ladies as well as for the guys. You can give virility to women. There is not like a contraindication. Um, Actually, in some school of thought, eating male gonads is associated with a calming effect on men and women. So, if
Rocky Mountain oysters. Is that what you're talking
just,
about?
so just eat more bowls. What can I say?
Right, I know Rocky Mountain oysters. I've had those.
All
So
right.
I think it's important too to notice, that, like you just said, the name Testo 180 would probably some women would say, "Oh, that's not for me," but it is for them just as much as men.
Yes. So what happens is testosterone is the female forgotten hormone. Uh,
Hmm.
it is not taught in schools. It is not taught in OBGYN residencies, the importance of testosterone in females. It is massive, massive. In my practice, that's one of the things that I see. It's one of the first changes that women go through in their 40s is decreased testosterone. Testosterone is the hormone of sex.
Yes.
Okay, it is the hormone of sex in men and women. Okay, it is the hormone that will elicit arousal. It is the hormone that helps the area, your whether it's your female or male genitalia, get all that extra vasculature, nerve endings. It is the hormone that builds muscle. Okay, so you're more attractive to a potential male mate. um, it has to do with mental clarity. It enhances mood in the right ratios in men and women. Okay, so it is the forgotten hormone that nobody looks at. Everybody thinks of estrogen in women, and that is not the case. It's having the right balance. It's having the right balance.
We're, well, we're gonna have to wrap up, Doctor Lee. We got
So there's
some
one more.
really
There's
fun.
one more that I wanted to mention because
Okay.
Testo 180 tincture, um, even though it has the same name, it has different components. Testo 180 tincture is actually has it's becoming one of my favorite combinations. I will recommend it to the patients because of that combination of adrenal support together with the magnificent herbs that support the testosterone metabolism and testosterone estrogen balance.
Hmm. Hmm.
If I were to choose, this would be it. I actually take it myself. I've noticed some wonderful like mood balancing effect. I'm happier. I'm in a better place. I know that some patients don't like tinctures because of flavoring and personal preference on those patients. Then I will resort to the Testo 180 that we discussed before. Okay, boom, boom.
All right.
Questions.
Oh, Oh boy, this is good. I think this is the first for us, a sexual health workshop. So I'm looking forward to seeing the comments and any questions anybody might have. But we do have to wrap it up now because we got Dr. Len Brantowitz coming up next. So thank you, Dr. V. It is always a pleasure. Everybody, don't forget Dr. V's book, The Healing Circle. Get a copy of it.
All right.
Thanks.